Hello there, I'm Miranda and this is Take a Moment with NCH&C, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
Hi there, I'm Harri Smithson. I am a career development facilitator for Norfolk Community Health and Care, and I work in the Talent for Care team.
First things first, I'm going to ask probably a very stupid question, but what does talent for care actually mean?
It's not a stupid question at all. You tend to have Talent for Care within many different NHS trusts. We are a team that supports those to get into the NHS. So that can be through apprenticeships, working with local armed forces, communities, and working with places like the job centre as well.
Oh, okay, so you go out to the job centres, do you, and sort of showcase what it is that we offer?
Yeah, it's about showcasing as an organisation what we can offer, but also supporting those who may have been out of long-term employment or not had like an interview or applied for a job recently or had that feedback. And we're there to support them to develop those skills and to gain that employment. And then to support them further in further training. So, if they, for example, wanted to do more training and into an apprenticeship, we can support them with that.
I bet many people don't know about that, you know. Do you get that quite often from sort of internal staff that people don't realise that your team is there for those particular reasons?
Yeah, if I'm really honest, we are desperately trying to become a bit more visible within the organisation and also externally as well. So people can come to us and feel confident to come to us and asking for that support. It's more the things like interview and application skills that people find a bit worrying about to approach us about. Everyone's looking for, you know what I mean, those development, those skills. There's no shame in asking about different methods to support your learning, and that can be also development within the area you're also working in with a short course or something longer.
Well, interviews are horrendous, aren't they? I've never met anyone who actually enjoys an interview. They're terrifying. You don't feel like you've got who you are across because you're so worried about saying the right answer. And a lot of them are competency based, aren't they? So you have to
Yeah,
make sure you have said particular words, and it's just the panic and the stress. And so I guess knowing that you could come to your team and ask you for some help and some support with that would be a huge weight off someone's mind.
definitely. I think from my own personal learning, before joined the NHS, I kept getting the feedback, "Oh, you're not giving us enough detail." And I never understood why. And then I learnt the STAR method, which is a method to structure your answers. So situation, task, action, result, and reflection. So the reflection one's really interesting as well. So that's given me the idea to put my points across, but also give the person I'm talking to all the detail. What's also helped with knowing that structure is now that I am doing an apprenticeship, is how I evaluate my own learning. So I have to write down what I've learned from each activity, and it gives me the structure to again explain the situation, tasks, and things like that, and give a full picture.
So that's interesting. So apprenticeships aren't just for clinical staff. You're in the corporate services side of things
Yeah.
and you're doing an apprenticeship yourself. So tell me more about that.
So I am doing a level 5 HR apprenticeship. Worked in the recruitment team, and now I work in the talent for care team supporting other apprentices. I think one of the biggest things I have learned now I'm an apprentice is actually how much resource we do have in the trust for apprentices to support them, but actually what needs updating and what needs improving.
This might be a personal question, so don't feel like you have to answer it, but do you have to take a pay cut to do an apprenticeship?
No, no. So that's one of the really positive things. If I'm honest, if I did have to take a pay cut, I probably wouldn't be able to afford to do an apprenticeship. But what's really good about an apprenticeship is I stayed on the same band as I'm already working at. So it doesn't mean that anything different apart from I get 1 day a month study time. So I have got a dedicated day. I mean, it depends on the teams you work with, but I've got a dedicated day a month where I sit down and do my studies. But that's one really good things about doing an apprenticeship is that you don't have a pay cut. It's not going to affect you financially. You don't pay anything towards it yourself. It's all funded by either NCH&C or the government or part and part. So it's not like you're coming out with any sort of university debt or anything like that either.
in this current climate. That's really important for people to know, that you can still further your education and your career without having to take a pay cut. In some companies, you have to stay for a certain length of time when you've finished something like this. If the organization is funding a course for you, for example, then they often put a clause in that says you have to stay for a particular amount of time. Is that something that happens at NCH&C?
With NCH&C, they say that we would like you to stay. So you can't, any organisation, they can't tell you you have to stay, otherwise you have to pay the payment back. That's not allowed. So that's against apprenticeship rules. So I think it says within our organisation that we'd like you to stay for 2 years. But again, I think it's about ensuring your development within the trust as well. So we do these courses to grow our own workforce. So it's supporting our future of the organisation. So really, it's a positive that they're wanting you to retain you, but it's also a positive that you've got that learning.
And also, isn't it about keeping people within the system in general? So, like, for example, you might find that you want to further your career by doing a particular course, but we don't offer that, but the NNN does, for example. So you might go off and do a job there for a bit, but then you might want to come back. And is that okay, that, people might want to move around within the system?
Definitely, and I think it's healthy too, if I'm really honest with you. I've got apprentices who are interested in really branching out and seeing what opportunities there are. And what's really positive to see, especially those who sort of coming in on a level 2 as a healthcare assistant apprentice, the ward managers are more than happy to support them if they want to go over to a different site and shadow for a day.
Let's say somebody was thinking about starting an apprenticeship, especially having now heard that it's not as financially draining as perhaps they might have thought. They might think, right, brilliant, I'm going to look into this. What kind of things do we offer, and how do you get started with applying for one?
So there's two ways really. If you wanted to come in as an entry level apprentice, so that's a level 2 or level 3, for example, clinical cohort, so for the healthcare support worker apprenticeship, that would be a level 2. You would need to look at NHS jobs, do a few cohorts a year for healthcare assistants, and also with that apprenticeship, once you've completed the apprenticeship, you are entitled to a guaranteed job within the trust. So that's a really positive thing to also think of. With non-clinical, again, entry level, it would be good to look at NHS jobs again, but they are a bit more ad hoc, so that can come up any time in the year. Finance tend to have an apprenticeship cohort towards the end of the year as well, so that's something to bear in mind. With higher level apprenticeships, even some level 3 qualifications and upwards to level 7, so that's master's level, they would be offered internally. So what you would need is to have passed your probation period and have your manager's support. Then you could apply for an apprenticeship. I would suggest contacting the Talent for Care team to see what apprenticeship would sort of match your job role, because that is one of the criteria that it would need to match. Is the apprenticeship needs to be done as part of your job, so there's enough learning and things like that. So if you are looking for a higher level apprenticeship and you haven't got a job within NCH&C, the first thing you would need to do is gain a job in NCH&C, which again is NHS jobs. And then after you've passed your probation, you would be able to then seek out an apprenticeship.
I'm thinking it's a lot of work. It's a lot of time that it takes to do. It's a lot of effort. Why do it? What are the pathways that it leads to? Obviously there's, like you say, some of them will give you a guaranteed job, which is amazing. And obviously it's to better and progress your career. But are there any other benefits to doing an apprenticeship versus doing any other sort of qualification?
That's quite a common question we have actually, especially when it's looking at the clinical apprenticeship. Say if someone wants to become a registered nurse, at school events, I regularly get asked, I want to go to university and become a registered nurse. What's the difference if I did it through an apprenticeship route? There is positive and negatives. Positive for apprenticeship route is you come out with no debt. You get the learning on the job. You get to experience different areas. Again, you'd have placements. So you would circulate through different environments. So working in the community, the acute. One of my clinical apprentices has recently done a placement in a prison. So they're the positives. So it's a lot on the job learning. I would say it's probably a little bit harder because you are still trying to do your job, and you're learning and studying at the same time, you'd also still continue to go to university and go to lectures. If you went the university route, the course would probably be shorter. So instead of doing it in 4 years, you'd do it in 2 years. With the university route, it's placement based, so you wouldn't get paid when you're working on a ward. Obviously, doing the apprenticeship, you'd be doing the role and learning. So there's different positives and negatives. And the main feedback we get from those who have done the apprenticeship route is that they're really glad they've done the apprenticeship route because even though it is a little bit longer, they have come out with no debt. They do feel confident working in the environment they have worked in. They feel like they know what they're doing and actually have that a little bit step ahead of those who might have come through university and not had as much clinical interaction and clinical skills. I think there is a misconception that apprenticeships are for those who are 16 to 25, and that is not the case at all. You can do an apprenticeship as long as you're above the age of 16, you can do an apprenticeship until there's no age limit, basically. And I think that's to progress people's skills, and also it's to support those people who do start a career and then decide maybe they want to switch a career. And I think that's absolutely fine. I mean, I was good at art, so I went to art university, got a fine art degree. Now I'm working in HR. So there's not much correlation. There's skills that I've taken from that education and pulled it into this organisation and into my job now. And I think you do that whoever you are, or whatever skills and whatever experience you've had. I would say if you're thinking about learning, it's a really good route to consider. It might be a little bit longer than maybe a short course, but you learn so much. I was shocked how, I mean, working in HR already for nearly 3 years now, I thought I knew quite a lot. I had no clue. I had no clue until I started this qualification. And I'm only 3 months in now, and I'm just learning so much. So you never know. You really don't.
It's about opening doors and opportunities, isn't it? Because you could have been doing a job for any number of years and just think, oh, you know what, I fancy a change. I fancy something different, but I don't know what that is. And quite often our instinct is to look on NHS jobs or to look somewhere else externally to your current place. But actually, the conversation should start with the talent for care team, shouldn't they, as to what's available internally that you might not be aware of. Could sometimes be crossing the line from clinical to corporate or vice versa. You know, you could have been working in IT and decide you want to be a nurse, and that's also fine. You know, I think it's just we're talking at the minute about, aren't we, about those change chats is something we're
Yes.
advertising at the moment. Is take a look at what you could do before you make a decision to leave. It might be that your current role isn't the right one, but that's not to say there isn't something else here for you.
Definitely. I think there is so much opportunity within the trust. I think sometimes what we forget is where to look and who to ask. And sometimes that's the talent for care team. So sometimes it might be a bit closer to home. So it could be someone like your manager. But it's always a little, I think people find it a bit more difficult talking to people who they work with. And it's because it's a bit more sensitive. But the talent for care team are always available to talk to anyone if they've got a query about changing route on their career direction. And that, again, as you're right, that can be clinical to non-clinical or vice versa. Could be completely looking at something else. We've got a few tools on, for example, healthcareers.com that has like a 5-minute quiz. And if you're not really sure what roles might suit you, this is a really good tool to look into roles within the NHS that might suit you.
What if you have a disability or a long-term health condition and you're
Yeah.
thinking, I'd love to do an apprenticeship, but I don't know whether my particular needs or reasonable adjustments would be catered for? Is that something that is considered within the apprenticeship schemes?
As an organisation, we are a disability confident organisation. So that also means that we would support you within the workplace. We do try and move towards working full time on apprenticeship. If that doesn't support your needs, we can look into doing it part time, but that is down to the education provider. One thing we really do support within the organisation, we do an occupational health assessment, and that's to assess any sort of adjustments, any sort of support needs that is there to be made clear, basically. And we, as an organisation, should put those supports in place. Talent for Care isn't just there for like a middleman. We're here for wellbeing support. So what we'll do throughout the apprenticeship is we'll check in. It's either once a month to once a quarter. So depending on the course you're on, but it doesn't mean that you can't talk to us in between if you're struggling or anything like that. So we do really try and support our apprentices, whether it's a disability or a support need early on, or if it's something that might develop later on. I know people who they were partway through their training nursing associate course and they realised they were dyslexic, for example. And once they had their assessment and was diagnosed with dyslexia, they were able to have that support.
What would happen if you got halfway through the course and you just were struggling, and you didn't feel like you could complete it, or more simply than that, that you just weren't enjoying it and you wanted to stop? Sometimes it can be quite difficult to quit things. Is that something that would be okay?
What we would try and do, so as a bit of a first provision, if you were struggling well-being wise or you've got a heavy workload, sometimes there's personal circumstances, what we would suggest is we'll have a conversation with yourself and would probably suggest a pause on the apprenticeship. That obviously would depend on the apprenticeship you're on and the contract you're on. So if you're on a fixed term contract, that might make it slightly different. But if you're doing an apprenticeship on top of your current role, probably suggest a pause. This will then give you a bit of time to process how you're feeling, and then we can come back to it in about a month's time or maybe a bit later and talk about what we then want to do as a collective. So if the apprentice has said, right, now I just want to quit, and has given absolute justification reasons, what I would personally do as a mentor would be explain the implications if they did leave the course and what that could do later on. So, for example, if someone was partway through a qualification and they said, "No, I'm done, I'm not doing it anymore," and I'd explain to them that they wouldn't be able to do the apprenticeship route again. So they would have to self-fund it if they did that qualification. And there is implications like that. We don't see often people completely drop out unless it's a role where they've gone into like an early staged role where they've gone into it and they've gone, actually, this is not the career I thought it was, I'm going to leave. And this is where work experience is quite key to have, because especially in the last few years when we haven't been able to have work experience, I've seen personally people come into the organisation on, say, apprenticeships, and they could have done the work experience and gone, actually, this is an environment I think I'll thrive in. This is an environment actually probably not for me, or I want to go in a different direction. And they could have used that before they'd gone on to the actual full-time apprenticeship. And then they feel disappointed in themselves that they've not completed it. And it's actually nothing, like they should be proud that they've got to that stage and actually made that decision. It's not right for them. They might approach it some other time and they've developed those skills. So they've not lost anything from it, but it's one of those things, if you do leave an apprenticeship, you just need to be aware of maybe what the consequences later might be.
Yeah, I think that's really reasonable actually, and I think it's important that people realize that you're not tied to something. It's actually very brave to say I'm struggling, but that doesn't mean you have to stop altogether. Like you say, there's processes in place where you can be supported to maybe take a
Yes.
pause, which is great.
Yeah.
And you mentioned there you're a mentor. What does that mean for you and for your apprentices?
To be honest, it's lovely being a mentor. So it's rewarding in the fact that I get to see apprentices go from joining the trust right through to completing and supporting them with any sort of struggles or anything like that. It gives me a drive, if I'm honest. It gives me a drive to help people. And I think that's something that I'm really passionate about. I had an apprentice recently who was originally started in the trust as a entry level on a level 3 qualification and now is a band 5 staff member and has done really well, really vocal across the trust, and I can just see the confidence and passion there, and they've inspired me. So it works both ways. And we did a final review a few months ago and they were so thankful, and it's just nice to see those achievements for those individuals.
What would you say to anyone considering an apprenticeship but is perhaps thinking, I don't have time, or it's not the right time in my life, I've got a lot going on in my personal life, I wouldn't be able to commit to it? What would you say to those people? What advice would you give?
I'd say there's probably no harm in doing the research. I think you don't know how much something can change your career and your life without looking into it. And that can be doing your own personal research online, or that can be talking to us in the Talent for Care team. If I'm honest, I've been in that situation where I've put everything on hold and gone, I'm moving house, that's too stressful. I'm gonna wait for the next time. And I do slightly regret that, if I'm really honest. But now I'm doing the course, it's liberating. So I think you do have to think sensibly about it for yourself and your own understand your own limitations. But again, when you do feel ready to do it, you've then got all the information and you probably know who to contact to start the apprenticeship and things like that. So it's really positive to do the research so you know what to do when you're ready.
Thank you for listening to Take a Moment with NCH&C. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCH&C on all social media channels.